It's a very simple diagnosis to make that there is a bilateral CDK. These are the early X-rays when the child was first seen by a person in 2002. This was her hip where it was normal. Ultrasound also was normal. And when this patient came to me, this is how the child looked to me. You can see I cannot flex the knee. And these are the X-rays, the time when the child came to me. I tried to do the maximum flexion and take the X-ray, and this is all that I could flex further. I thought that, what can I do for her? And I opted for casting under anesthesia. And as I have written here, I did twice. There was some give. Every anesthesia, it was a nightmare for me and for the anesthetist. This is something I'm talking about in 24 years back. Patient went away to Indore for some time. And then the patient came back to me, and we were back to square one, and I decided to operate. That was on 28th of December 2002. And I did VY-plasty and retinacular release by Curtis and Fisher. I'm running fast this. And during the operation, what happened, I could not apply the tourniquet. Incision had to be sufficiently long from lesser trochanter to the distal to tibial tuberosity, sufficiently rectus flap. Patellar tracking, there was necessary release when I tried to do that whatever is required happens. Suturing I did at about 60 to 40 degree flexion. POP cast, taken care of the skin, new cast with further correction in 2 weeks. That was done. These are the casts. That was the 9th of January 2003. Again on 9th, this is how the skin looked. 16th, then on 22nd, it was healing all well. There was no infection as such. And this was the amount of flexion I could achieve on 13th of February, and when I gave the plasters. This is how on 28th of March the child was. And the child was with the brace, even was able to walk about in my OPD, And these were the X-rays on the April 2nd of 2003, good flexion. Then the child was about to stand with support. That was in the May 2003. Extension leg was 15, flexion was 100 degree, and we continued passive exercises and braces at night. In 2008, this is how the knees looked. This was the amount of the movement the child had, was able to sit cross-legged, and this is how the child walked. This is how. This is how she was able to even run. And these were the X-rays, and in this you can see that there is patellar baja, as well as there are newborn formation. The round circle red, that is the newborn formation on both sides that had happened. These are the MRI which was done in 2024 because she had pain in the knee, but the radiologist reported as patella baja and extra newborn formation, otherwise normal. I had done the telephonic interview of this patient, exam on 16th of this month. She can stand as long as she wants to. She trekked to Everest Base Camp, can walk 6 to 7 hours a day, good balance, can run, stairs, normal. She plays badminton and pickleball, expert Garba player. She can use cycle, motorcycle, and a car. Short in height, that is her problem. She gets leg pains occasionally. She had rickets when she was only 1.5 years, and I had to treat her. Now she has PCOD also. She is very much bothered about these scars. This is how she looks at present. Excellent flexion. This is what she did, bungee jumping. This is how she is able to walk on the snow and sleep even. I had done the review of literature, and there is 1.7 occurrence in 1 lakh of births. Most common with breech presentation. Quadriceps, anterior capsular contractures are there. Cruciate ligament may be attenuated. Mostly patella hypoplastic. That is what it is there in this patient also. Associated musculoskeletal abnormalities are in 82%, hip dislocation 50%, elbow dislocation 10%. Review of the literature, management, grade 1 and grade 2, we can treat with serial plasters. Grade 3, open reduction. Roll-up traction was controversial. These are the 3 types of surgery treatment which you can give. I'm not going into the detail, they are there in the literature everywhere. These were the references I had gone through. And now this is where she was at the base camp with her mother. Her mother has supported this child maximum. Wish you all a very happy Republic Day. Thank you.